We are once again joined by Dr. Todd Ellerin, who is Director of Infectious Diseases at South Shore Health. Doctor, thank you so much for joining us as always. Today, the CDC director said that we could have the worst fall in public health history if people don't follow recommendations like mask wearing and hand washing. That's a pretty dire warning. Why is he so concerned?
It really is, Maria. You know, I think the bottom line is we have to remember history. Back in 1918 with the Spanish influenza, the second wave of the pandemic was much more deadly than the first wave. Hopefully that doesn't happen, but what the CDC director wants us to remember is that if we're physically distanced, if we're masking, washing our hands and avoiding crowds, we really could prevent just another loop in a serious epidemic curve.
So, Doc, the average age of people infected with COVID-19 in Massachusetts appears to be dropping because back in April, it was 49 years old, but by May 1st, it had jumped to 54. It has fluctuated, and as of August 1st, the average age is around 50. However, the average age of people hospitalized and those who have died remain steady. I know that's a lot of numbers we've thrown out there, but what's happening that would account for that?
So, Ed, I think overall what we're seeing is mobility, meaning the people that are moving around more are going to be the ones that are more likely infected. So I think we're seeing a younger group. That's good news because remember, it's still the elderly and those with chronic conditions that have the worst outcomes with COVID-19. So one thing I do want to highlight, though, is the CDC just came out with a study in kids that showed that hospitalizations with kids are greater in the Latinx and Black children population. That's important. 7 times and 5 times more likely than white kids. So we want to remember that and also note that those kids are more likely to have chronic conditions, which may be leading to that. Still, though, the likelihood of hospitalization is very low with children.
I was going to ask you, do you have a reason why? But you maybe just touched on it right there. Yeah, right?
That's right.
Yeah, okay, good, thanks.
Doctor, in some cases, I feel like we ask you this every week, it's taking weeks for people to get their coronavirus test results back. So explain why there's a delay, if you know, and if someone gets a test 3 weeks later, does it do them or their community any good at that point?
It's really frustrating, Maria, and even though people are doing as best they can. You know, Time Digital just described it as a Hunger Games for laboratories, meaning that labs are fighting for limited resources. You know, there's long lines that are going on. People have to wait hours to get the test. It can be an uncomfortable test, and then if they're waiting 4 to 7 days or longer to get the results, that's not helpful. A recent study showed that if it takes more than 3 days to get your result, that really impacts the effectiveness of the test, isolate, and trace, you know, basically performance that we need to do in order to keep this epidemic under control. We need to do better. The supply chain for the diagnostic manufacturers can't keep up with the demand right now.
Doc, we've reported in the last 24 hours that the Children's Hospital in Philadelphia, the study seems to indicate that Boston's going to become a hotspot.
Right.
Are you worried about Boston becoming a hotspot?
Of course, Ed, without question. Why? Because as we know, as fall comes, we tend to go indoors more, and we know there's much more likelihood of indoors transmission than outdoors. So, but I think, listen, Massachusetts is really doing unbelievably well right now. Our percentage positive is 1.8%. If we can keep it like that, we're going to do well, but it's going to be tough as winter comes.
Doc, thank you so much. It's always
Thank
great
you,
to talk to you.
Doctor.
Thank you.